So chapter 19, sleep wake disorders, is the one that we weren't able to get to the other day. So this is a fun little, this actually has a really cool sound effect with it, but I turned it off because I know how you guys feel about those. All right, sleep. Healthy People 2020 added sleep to the list of current health topics, making sleep a national health priority. Fast-paced society, so sleep is forfeited. You guys know all about this because of the different obligations and everything that you have with nursing school, but that's not actually going to probably ever change because our fast-paced society keeps us busy. But it's said that the average adult should get 7 to 9 hours of sleep each night. So compare that to what maybe you get. But most Americans report getting less than 7 hours of sleep most nights, and I know that's true for me as well. So, consequences of sleep loss. So, the first thing is excessive sleepiness. Subjective report of difficulty staying awake that is serious enough to impact social and vocational functioning and increase the risk for accident and injury. The things that can cause this are things like self-imposed sleep restriction. That doesn't mean I'm forcing myself, but again, that's that societal issue in our fast-paced lifestyles. Shift work, so like shift work disorder is a real thing, and many nurses have it because they work third shift. Underlying sleep disorders, different medications and their side effects, alcohol and substance use, and then medical and psychiatric disorders. So more sleep deprivation. This is a state that occurs from a discrepancy between hours of sleep obtained and hours of sleep required for optimal functioning. The term only applies to impaired functioning due to sleep loss. Adults who sleep less than 6 hours per night report fare to poor health, mood disturbances, increase in pain syndromes or pain perceptions, impaired cognitive function and memory disturbance, and reduction in measures of overall quality of life. So if you think about when you stay up all night cramming for a test, and then the next day you feel like I wasn't really prepared for that, even though you were up all night, it's because you didn't get the sleep that you needed. So sometimes it's better to just close the book and be done so you can get some sleep. So normal sleep cycle, there's a complex interaction between the CNS and the environment. So non-REM, NREM sleep makes up 75 to 85% of sleep. It's composed of 3 stages. So stage 1 is the decreased body temp, muscle relaxation, and slow eye movements. Stage 2 occupies 45 to 55% of the total sleep. And stage 3 is slow sleep or delta sleep. REM or REM sleep, there is typically supposed to be 4 to 6 cycles throughout sleep. Atonia, which is basically like not, it's kind of like not having any tone, but so atonia, but it's like being paralyzed, prevents us from acting out dreams or nightmares. The longest period of REM happens at the end of sleep. And so these two over here, these 2 videos, oh shoot, I guess I don't remember how long they are. Let's look. This is non-REM. Oh, we can't hear it because I have the sound turned off. All right. I'm going to have to post these for you guys because you won't be able to click on. Oh, you know what? No, you can use the PowerPoint. You just open up the PowerPoint and go click on these. These 2 things are going to explain non-REM and REM a little bit better for you. So it's important that you go and watch them. I don't think this one, yeah, each one is about 3 minutes long. And the REM talks about with the dreaming. There's actually some really cool videos that you can click on that suggest after you watch these ones. So be sure that you watch both of these because you're going to need them to be able to answer test questions. They help to reinforce. So make sure you do watch those videos. Regulation of sleep. So complex interaction between 2 processes, and those processes are the homeostatic process, also known as the sleep drive, and the circadian process, which is also known as the circadian drive. So sleep drive promotes sleep, and circadian drive promotes wakefulness. And so some of the things that these are influenced by is like the light, that this is the strongest external cue to the body for wakefulness. Darkness is the strongest external cue for sleep. timing of social events, meals, work, or exercise, and then neurotransmitters. And so all of our feel goods that we've been talking about. Medications that cross the blood-brain barrier can affect sleep patterns. So examples, SSRIs can cause insomnia. We've actually talked about that before. So different medications and the way that they affect our brain can cause us to not sleep the same way that we should be. So sleep requirements are going to vary from person to person. So long sleepers require more than 10 hours of sleep each night. Many children are long sleepers because when their bodies are developing and growing, they need that long sleep. Short sleepers can function effectively on fewer than 5 nights or 5 hours of sleep per night. The basal sleep requirement is the amount of sleep required to feel fully awake and able to sustain normal levels of performance during times of wakefulness. So some sleep disorders that we have, breathing related sleep disorders, so such as sleep apnea. You guys can read through those right there, and hopefully you know what sleep apnea is. Circadian rhythm disorder, this is a misalignment between timing of normal circadian rhythm and external factors. So many types, however, the jet lag type and the work shift type are the most common. So people that have to travel a lot and for far distances will have jet lag. I went to Thailand a couple years ago, and I'm going to tell you, I didn't know what jet lag was until I took that trip, and then I knew what it was. So, you feel like it takes you 2 days to recover, to actually feel like you're a normal human being again. And then the shift work type, again, this is going to be a thing that some of you one day will be experiencing, likely because of third shift work at work that many nurses have to do at times in their career. That whole going to bed when the sun's coming up and going to work when the sun's going down, it messes with the body. Your body's not used to it. So, Provigil is a prescription medication used to improve wakefulness in adults who experience excessive sleepiness due to one of the following diagnosis sleep disorders. So, sleep apnea, shift work sleep disorder, also known as shift work disorder, or narcolepsy. This was approved in August of 2014. They use Provigil for a couple of things. So I used to actually know a few nurses that would take that on for third shift nursing before the sleep work disorder. But they also use it for MS-related fatigue. And I think there's something else now too. I can't remember it off the top of my head. I'd have to look it up. But no, it's been proved to be pretty effective for people for especially the sleep work disorder. So more sleep disorders. We have nightmare disorder. This is characterized by long, frightening dreams from which people awaken scared. This usually is going to occur in REM sleep after a long REM period late in the night. And it's different from night terrors, which typically occur during the first 1/3 of sleep, arising out of a slow wave sleep, and there's no recollection of the dream or dream content. So REM sleep, if we are awoken during that time while we're in REM, that's when we'll remember very, very vividly what was just happening in our dream. And some people can even put themselves back into those dreams when they're awoken from it and go right back to sleep. So almost, I'm not going to say always because it could happen outside, but almost always dreams and ones that we remember especially happen during the REM sleep. The next one, rapid eye movement sleep behavior disorder. This is absence of muscle atonia during sleep. So this person can act out during their dreams. Most common in elderly men, and safety for patient and sleep partner is the priority because they don't have that atonia the way that we're supposed to have, when they're in that REM sleep. Restless leg syndrome. So this is sensory movement disorder, uncomfortable sensation in legs accompanied by the urge to move. A lot of our patients in Brighton experience this during their detox period. The cause of RLS is unknown. Ropinirole, also known as Requip, which we actually use quite a bit in Brighton, is a common medication for treatment. The mechanism of action is unknown, although is thought to be related to its ability to stimulate dopamine receptors. So it just slows down that urge to move. And then substance-induced sleep disorders such as alcohol, nicotine, caffeine. Alcohol actually decreases deep sleep, guys, even though people use it quite often to go to sleep. It decreases the amount of deep sleep that a person gets. Nicotine withdrawal for people that, have a dependence on nicotine, it happens every night. So, that can actually cause them to not have the greatest sleep either because they're withdrawing from nicotine overnight. And then caffeine blocks neurotransmitter adenosine, promoting wakefulness, reduces slow wave sleep, and it also acts as a diuretic. So a lot of caffeine before bed means I'm probably going to get up and go pee. Insomnia, this is difficulty with sleep initiation, sleep maintenance, early waking with difficulty falling back to sleep. For an insomnia diagnosis, symptoms must be present at least 3 weeks, 3 times a week, a period that lasts 3 months despite adequate sleep opportunity. Daytime disturbances present, such as impaired work or social life, decreased concentration, memory impairment, somatic complaints, or mood disturbances. So those are the criteria for obtaining a insomnia diagnosis. So medication interventions that I've listed here for you, the medications are usually prescribed for no more than 2 weeks because tolerance and withdrawal may result. So there's kind of a catch-22 here. Many of our medications that we use can be addictive, and so it's only supposed to be for a short-term thing, and then the person's supposed to try to get back to a regular sleep cycle. But what we are finding and what has happened in the past, and you guys are seeing it as well in Brighton, people become addicted to these. So we have a couple of benzodiazepines that are used. We have benzo-like drugs that are used. Antidepressant. So trazodone, you guys are hearing our patients talk a lot about that. That's our main one that we use down in Brighton, is actually an antidepressant that was found to induce sleep really well. So, and pretty quickly, honestly. Every now and then I have a patient say it takes them longer, but most patients fall asleep pretty quickly with that. And this addictive thing here should have actually been up here. So benzos and benzo-like, these four are all addictive. Trazodone is not addictive. So make sure you heard me well, okay? Even though the arrow's pointing in the wrong way here, it should not be pointing at trazodone. Trazodone is not addictive. It's the other four up here, the benzo and the benzo-like drugs, that are addictive. And then we have antihistamines that are used. So most of your over-the-counter sleep medications all have some kind of Benadryl in them. ZQuil is just liquid Benadryl, and then your Unisom. So these antihistamines work, by helping induce sleep. However, not approved, the Benadryl not approved for sleep, but we know that it's a secondary a secondary gain, I guess, that a person can get from taking something like a Benadryl. So even though they're not FDA approved for sleep, we definitely use them for that. And then so I had that, but you guys don't need to do that. And that's it for this chapter.